Hello out there in television land. Welcome to It's Your Health. Fipster with the Fipster here. Bringing you the latest and greatest in healthcare information. We'll be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back. Welcome to It's Your Health. If you're within the sound of our voice, you're hearing the latest and greatest in healthcare information. Your leader in healthcare information, It's Your Health. I'm here with the Fipster, and we're going to be plowing through. We don't like to use that word plow after this winter, but nevertheless, we'll be plowing through things that will help you and guide you in your maintaining a healthy lifestyle. So, with that in mind,
you're done?
we only have a half an hour.
Longest intro. It's going to be the longest 45 minutes. All righty, let's get on with some headlines. Artificial pancreas has been tested for type 1 diabetes.
And is that what it sounds like? They actually may be able to transplant or put in a pancreas, kind of like a mechanical heart?
Yes, actually. It's these are what we're now using are insulin pumps that are able to sense real time what your sugar is doing, real time. You know, they haven't been able to pair that quite correctly. And so now we're actually able to basically create a synthetic pancreas that is able to manufacture insulin on demand when it needs to, so you don't have to worry about settings, you don't have to worry about checking your sugar. The device will do it all. You know, it's amazing the technology that they're coming out with.
It is amazing, and when I think of when I first started, we didn't have very much for diabetes. Now we have a whole menu of stuff, so good news.
All right, moving on. Ban on trans fats is producing healthy results. You know, lately, a few years ago, New York City kind of changed the world and said, we're not allowing trans fats anymore in New York City. So, because New York City said it, every fast food company in the country stopped using trans fats as their oil to make French fries. And that's probably when you notice the change in taste. Well, it turns out that's been a good thing. They've actually seen in the areas where they've made these bans and in countries where they've made these bans, there's been a marked decrease in the amount of strokes and heart attacks and heart disease in general.
Right. Our body can't really break down those trans fats as well as other fats. So that's why they kind of linger around and latex our arteries shut.
This one's probably going to be very seasonal coming up. Tick bite can cause meat allergy.
I've never heard of this, Fipster. You got to.
There's a tick that's called the Lone Star tick, but we do have this tick in our area. It's not a deer tick, but the type of tick-borne disease that they can give actually can cause your body to think you're allergic to red meat. And I've had patients say that they have bad reactions and allergy to red meat, and I kind of used to, oh, okay, I guess. I'm not sure how that's possible, but this is how it's possible.
That is unbelievable. So I guess we're going to be heading into that tick season. I know we had a couple of tick bites in the winter. Despite winter,
already, yeah.
We saw that. In fact, in our dogs, when we leave them out and have them come back in, I pulled a couple deer ticks off them.
Alrighty, moving forward. Let's talk about some different topics. You know, we've talked about sleep apnea before, but I think it deserves some talking again. Sleep apnea is a big concern. We're seeing more and more patients with it. I think it's very underdiagnosed. Why don't we talk about that for a moment?
Sure. Sleep apnea generally comes to our attention when a wife of a loved one says he snores all the time, and that's sort of a tip-off. Snoring, and if you observe someone who actually kind of stops breathing for a couple of seconds and then tries to catch their breath while sleeping, that's sort of a tip-off. The other thing is we hear a lot of daytime drowsiness. Even though I sleep, I'm still sleepy. And what happens, particularly when you lie flat on your back, as this diagram shows you, your tongue will go back and physically obstruct your airways, which creates the snoring. And it's just not a question of snoring. When you stop breathing, your oxygen levels will fall, your heart may skip beats, it may lead to hypertension, other types of problems with your heart. And along with the daytime drowsiness, the sleep apnea can create a whole bunch of other symptoms. And again, we usually see it in someone who's short and stocky, but that's not always the case. And it's easily diagnosed with home sleep studies these days, and it's even easier to treat. And so, as Phil says, it's underdiagnosed, which means it's also undertreated. You want to amplify on that?
Well, I think if you we live in an online world, so if we go online, you can easily find what's called an Epworth sleep scale, and that is something that we actually use to determine whether or not you're someone who's at risk for sleep apnea. And that's a very simple questionnaire that you can fill out online. If any of those things seem positive, it is worth getting it checked out because it can be fixed. So many people are used to just being tired all the time. It's a chronic condition. They just accept that as life. And it turns out that's not the case. And they actually have an awakening-like experience when they start to use that CPAP. They really don't realize how bad they had it until we fix it. And it's not just a sleep problem. It's not just a fatigue problem. This leads, to blown out heart valves later in life and all kinds of different kind of heart problems that can be linked back to simply we're just not breathing at night right. So it's certainly worth looking at the scale, downloading it. You'll see it on the screen here as well, and going from there. Let's for a moment talk about some drug interaction issues. Anymore when we're doing our refills requests for patients, we're getting a lot of interaction requests about long QT syndrome, and that's something that we used to know only a handful of medications did that, but now it's everywhere.
Right. This is something that we see on an electrocardiogram. There's P, Q, R, S, T waves. And the prolongation of the QT wave can be a problem because the repolarization or the re-excitement of the heartbeat can be delayed by that. And you can have abnormal beats to try to take its place. Some people are born with this. They can have, and you know who you're out there because you would have had a cardiogram that said you have a QT segment prolongation. But a lot of drugs will make it worse or even cause it. So, and unfortunately, we're seeing more and more pills that are prone to that. So if you get a blowback, as we do on some of our prescriptions, you'll know why.
Yeah, it's something that these interactions probably have been there for a while, but it's only very recently we've begun to understand how much a lot of these medications interact, as well as things you might be taking over the counter as a supplement. Those are the things that are really untested, and so it's always worth having all your medications looked at, whether they're prescription by someone like us. Is your eye doctor prescribing something? You're seeing a nutritionist, they're prescribing something, your chiropractor's giving you pills. There's all kinds of different people who have their hands in this pot. There's going to be some potential interactions, and so it's certainly worth looking over before you run into trouble.
So if you go on the internet, look up long QT syndrome, and you might get some more insight into it.
Well, I think we're just about the end of this segment, and I wanted to talk about a new diabetes medication. I'm hoping we get a chance in the next segment.
Sammy, will we get a chance to talk about this new diabetes?
That's good. That's the right answer.
He's nodding yes on the camera. So we'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the fastest 30 minutes in television history. You're right, it's Your Health. Philip Benyo with Philip Benyo, going over some healthcare information for you.
All right, let's get back to the headline.
All righty.
Aspirin may protect against dementia in type 2 diabetes mellitus. Yet another thing that aspirin is good for.
I love aspirin. Take a baby one every day. Of course, you should too if there's no contraindication to that, like other blood thinners or prone to bleeding or ulcers or things like that. But this dementia business is actually an abnormal plaquing of the nerve fibers in our brain, and it could be inflammatory, which has some dietary issues as well. But that being said, an anti-inflammatory like aspirin, not your non-steroidal anti-inflammatory agents, by the way, but the just use of aspirin in and of itself has been shown to draw back this a little. And it's going to cut down your cardiovascular and stroke risk as well.
Absolutely. Number 2, FDA warns against clarithromycin or Biaxin use in patients with heart disease.
Yeah, you got to tell me a little bit more about this. I've kind of heard about it, but maybe you can enlighten us more.
Well, that's one of the older what's called macrolide antibiotics. It's actually somewhat similar to, say, Z-Pak or Zithromax, which I'm sure everybody's heard of. We really don't use clarithromycin very often anymore because it has a lot of nasty side effects such as GI upset. And for me, when I personally took it when I was younger, a metallic taste in your mouth. Yep. If you want to taste what it's like to chew on screws, take that medication. About the only time it's used right now that I can think of conventionally is in a Prev pack,
Yep.
in someone who has H. pylori, which is an infection in your stomach. Clarithromycin is part of that regimen of 2 weeks of medication. So if your doctor does end up prescribing a Prev pack and you have a history of some stents or some heart disease, it's certainly worth looking and seeing whether or not you're a candidate for one of the other protocols.
Right.
It's a nasty medication just on your GI tract, but I mean, it worked for what it worked for.
Exactly.
Last headline. Blood test approved in patients with concussion.
You got to be kidding me.
What do we normally look at concussions? It's CAT scans, MRIs.
Yeah, do you see one or two fingers?
Things like that. I know at Dr. Kislin's office, they have an eagle eye thing. They're able to track your eye movements to see how well you track. It's really neat. However, they actually now have a blood test, which other than knowing that there's a blood test, I don't have a lot more information, but it was recently approved by the FDA that there's a blood test to see whether or not someone has had a concussion.
Put me in, coach.
Yeah, they'll have this on the sidelines in the NFL games.
Run it stat.
Alrighty, let's get back to that medication.
Yes.
Medication.
Yes, tell us all about it.
Alrighty, well, I mean, diabetes is certainly on the forefront of all the medical problems that we have. We just talked about it, increasing the risk of dementia. So treating diabetes is very important, and also treating one of the other core defects with diabetes is weight loss is also very important as well, because usually obesity and diabetes go hand in hand. Leave it to Novo Nordisk, the discoverer of how to use insulin properly,
Right.
inventor, if you will,
Yes.
of insulin, to come out with the newest medication, Ozempic. Ozempic is a once-a-week injection for diabetes to help really reverse the diabetic process. This is in the same class as like a Victoza or Byetta, but now they have once-a-week versions. So the once-a-week versions that are also out there are Bydureon and Tanzium, which I believe was just taken off the market because no one liked it, and Trulicity. However, Ozempic, everybody had issues because all their injections were in an oil, and so they had to be in an oil immersion, which means you can't push it through a small needle. So in order to push the old medications, you had to use a needle that was actually thicker than this, and we'll show you this on the camera a little bit later, but although this is a long needle, this is also a thick needle, as opposed to...
Wow, size matters.
Yeah, well, when injecting, smaller matters. Needles,
Wow.
that is.
That's
So,
impressive.
A once-a-week shot that's very easy to give. It has, it does a stellar job of lowering your A1C, but what's also very unique is it does a better job than any other medications out there in the diabetes class with weight loss. People are seeing a 9 to 12 pound weight loss with this medication, and that really helps reverse the diabetic process as well.
Win-win.
Number one side effect is nausea. Everybody gets that when they start these medications. That's a good thing, helps slow down eating, and it also goes away. So exciting medication. I'm kind of looking forward to using it.
Impressive, impressive. Like a lot of these medications that have come out new, getting the insurance company to pay for it is
It's going to be a bit tricky.
the speed bump here.
All right, let's talk a little bit more about medications and something that we've seen a lot more of. Clostridium difficile. This was something that when I started working, I saw this like twice a year, but now it is a weekly occurrence.
C. diff is a problem. It's a bowel infection, usually induced by antibiotics, which paradoxically you treat with antibiotics to get rid of it. Can be recurrent and can be very debilitating and disabling. And here, proton pump inhibitors, which were once the darling of our prescribing habits, have come under fire for helping to cause this?
Well, I think so. That's at least on a study of patients who are in the hospital who were being co-administered an antibiotic as well as a proton pump inhibitor. There was a much higher risk of getting C. diff. Now, we use proton pump inhibitors all the time in the hospital. It helps reduce stress-related ulcers, and it's actually an important medication. So there are some times you have to use it. But I think it's very interesting. We're seeing a lot more C. diff over the last 10 years. And when I started working, proton pump inhibitors were the new thing. They weren't as conventionally used as they are now, and they certainly weren't available over the counter.
No.
But now you can go to any pharmacy, buy your proton pump inhibitor over the counter, and continue to take it. And this is one of the many things I think we're finding now, that these things do have some long-term consequences, interactions.
Particularly thinning of the bone, osteoporosis, and perhaps by the acid reduction that you don't have anymore when you take a when you take a proton pump inhibitor, you limit the acid, which may actually have killed the C. diff from getting in your system to begin with.
Acid is a good thing.
Acid
it's important.
is a good thing. Absolutely.
Being completely non-acidic, that has consequences. Sometimes it's better to manage heartburn and GERD symptoms with some dietary changes.
There you go.
That we have a hard time accepting sometimes.
Not fun.
Alrighty, where are we at now?
We are talking about STDs, I thought.
Well, we do have a little bit of time. We'll talk about STDs. How do we cover STDs in a minute?
That's pretty
That's all it takes to get one. So, I mean,
That's right.
certainly in a day and age where there's a lot more birth control being used, at least pharmaceutically, we sometimes forget that pregnancy is not the only thing that can happen that may be potentially unwanted during intercourse or any type of sexual contact. But there's a lot of nasty STDs, and I tell patients all the time, I joke around, said, the STDs of your generation, the worst thing you could get would probably be herpes. Everything else you took an antibiotic for because it burned when you peed, and then you lived a normal, happy life. The STDs of my age were hepatitis and HIV, and I had to worry about all his too. But HIV and hepatitis, nobody dies from anymore. That's not the end of the world, so we're not really getting spooky or scared about that anymore. But the STDs today cause cancer.
Yeah,
and
it's a problem.
Head and neck cancer, GYN cancers. There's 20-year-old women who are having to get a hysterectomy because of an STD. And so, they were doing something to protect themselves from getting pregnant, but that's not where it stops. And so, this cancer risk that goes on, we need to really be much more proactive. Adults out there that have kids, you got to start talking about this young and talk about good old, old either fashioned abstinence. And if that's not a realistic expectation, you have to talk about barrier protection.
There you go. What a way to finish up the second segment. We'll be right back with the third and final segment of It's Your Health. Thank you. Welcome back to the third and final segment of It's Your Health. Philip Enya with the Fipster, bringing you the latest and greatest. So, moving right along.
Now, I feel I owe this to the show because, we are geriatrics and internal medicine, and so the last talk was really to the younger crowd and the parents, but where's been some of the highest rates of HIV and hepatitis? What generation is seeing that right now in the last 10 years?
Yeah, it's almost epidemic in the geriatric population because the risk of pregnancy, of course, is low, and they're not using barrier protection, and resort villages that have retirement people have had a very high uptick.
Absolutely. So to the older generation, still very important to use, barrier method protected sex or maintain a monogamous relationship with someone that's clean or protected, because it's just as much of a problem for the younger generation as the older generation.
That's right.
Cancer sucks no matter what your age is. So moving on to the headlines, now that we can get past that. NASH, or non-alcoholic steatohepatitis, or fatty liver, is rapidly overtaking hepatitis C as a primary cause for liver cancer.
Yeah, we see this a fair amount. We do regular liver function tests. They're bumped up a little bit. You go for an ultrasound and it comes back showing fatty liver. What can they do about this?
Well, I think it's just that we need to really stay on top of it. They actually showed statin use can sometimes decrease some of the fatty liver issues, and that's something against what we always used to do. It's like, oh, you have fatty liver, you have elevated liver function tests. Let's not use a statin. But statins, as we know, have a huge role in the anti-inflammatory cascade, but then a lot of it's about cutting out the other assaults to your liver. So if you have a fatty liver, and we're overweight, losing some weight's going to help. Avoiding hepatotoxic things like certain medications, alcohol. All those things are important to do, and then just really keeping a close eye on things. Sometimes when we're seeing fatty liver, especially associated with LFT elevations, we're sending people off to hepatologists or a liver specialist.
Right, exactly.
Run-of-the-mill GI specialist just doesn't seem to do that stuff. We need to go to a little bit higher specialized type GI specialist. Speaking of hepatitis, the ACIP unanimously recommends new hepatitis vaccine. There hasn't been a really new vaccine for Hep B.
No.
A lot of the ones that are newer are combo Hep A, Hep B shots, but I think this just goes to show it's still important to vaccinate our population against hepatitis B. There's a lot of older adults who actually aren't vaccinated.
Right.
As a child, you almost have to get it. They give it to you at birth, I believe, whereas Some of I got it in high school, but people who are just a little bit older than me, most of them probably did not have
Now,
it.
it's a series of 3 shots, the old one. Is this the same thing?
I'm actually not sure. It just got approved. I'm not sure what the recommendations are for it. And then hepatitis B is one of those things we can also check to make sure that you are indeed immune to
Right.
it. There's a blood test. Sometimes people say, well, I don't know if I got it. Well, I can do a blood test to see. Some people who have got the vaccine actually won't convert. Even though you give them the vaccine, their body just doesn't take the immunization. So that can happen as well. Lastly, the American College of Physicians sets a higher IDL hemoglobin A1C range for type 2 diabetes. They're actually recommending some people should be in the 7 to 8 range, but that's really against what everybody else is saying. There seems to be some internal struggle here.
Well, the hemoglobin A1C is the average blood sugar over a 3-month period of time. Keep in mind that sugar will go into the red blood cell and get stuck. The average life of a blood cell is 3 months, so they crush the red cells, look inside. If your sugar's been high over those 3 months, you'll have a high hemoglobin A1C. 6 is kind of normal, 7 is diabetic, and the higher you go, the worse you are, but you're saying perhaps we should allow some...
Well, for the longest time, the level was we wanted less than 7. But recently, maybe about a year, 2 years ago, they actually lowered the guidelines and said we want it less than 6.5, which actually is kind of tricky to get to.
It's hard to.
But our goal is to make diabetics look non-diabetic. But there may be some risk to getting that sugar too low. Especially for me personally, for the elderly population, I really don't like an A1C less than 6.5 because if I'm really driving and using medications to do that, hypoglycemia will cause a fall, and a fall will lead to a fracture, and a fracture will lead to you're never going home again. And so that's not our goal. Our goal is to live independent. So we're going to allow that sugar to rise a little bit. And I think maybe that's what this article is getting at, but I'm not sure. There still is a lot to be discussed.
Everything in moderation.
There you go. All righty. Now, we talked about dementia earlier, and sometimes we have patients come in probably on a weekly basis and say, I think I'm getting dementia. How do we approach this? What do we define it as?
What often happens in the office is people are concerned that they have memory issues, which they interpret as being early dementia. And I can only tell you that memory issues are common with time. They can be made worse by other comorbid conditions like diabetes, previous stroke, for example. But medications is another reason you can see memory impairment, but that's not dementia. Dementia, of course, is something that's progressive. It involves the accumulation in our brain of these neurofibrillary tangles. It's kind of like scar tissue and gunk in there that inhibits the ability for the brain to work and complete the nervous transaction. And it affects memory, but it also affects personality. It affects various parts of the brain, and unfortunately is progressive. Now, I kind of try to make sure when we approach a dementia patient, what's reversible. For example, medicines we mentioned, depression, you can have a vitamin deficiency, you could have had trauma. So that's one set of issues. The other set of issues is it a vascular dementia, which means it's treated a little bit differently. We don't use those medications for Alzheimer's, which I'm not really impressed with, to be honest with you. They're parachute drugs that slow down a garden variety dementia, but the vascular dementias, you will want to lower your risk factors, hypertension, diabetes, the things we always talk about, high cholesterol. But it's a costly problem. It's the 5th leading cause of death and disability. It's going to bankrupt the country because caregivers can't take care of these patients. They live fair amounts and extract a lot from families and society in general. So, big problem.
Yeah, I agree. It's one of those things that unfortunately, I still think there's a lot to be known about what's even happening here. And until we really get to the core defects and understand why some people get this and some don't, we're not going to have a lot of answers to prevent it. And that's what a lot of people want. They say, I want to prevent this. And the only thing I can tell you is to prevent the things that cause some of the things we know. Make sure your cholesterol is good. You should be taking aspirin. You should be exercising regularly. You should be exercising your brain. Retiring and sitting home and watching TV all day because you've earned it, because you worked hard all your life, That's a great way to sit getting sick.
Except if it's watching It's Your Health, because then
Well, that's you
we'll
should
keep
stand
you out
up
of
and
trouble.
jog and do air squats. I'm okay with that.
Thank you for allowing us to come into your home I always say that, to inform you and entertain you. It's tough to do at the same time, but we try our best. Thank you for watching us and inviting us into your home. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. It's Your Health, your leader in healthcare information. Thank you again.
It's Your Health.